So today you're going to be receiving a bag of supplies to take home with you. And we're going to go over first what you may experience the next couple days regarding your braces and the soreness. Your teeth are going to get sore. You may actually notice some sore spots from your gum tissue or on your cheeks. There's some samples in your bag. It's Orabase gel and some Pyroxal. These are available over the counter. And these will help with canker sores or any sore spots that you may get. This is more of a gel, and this is a rinse. Again, you can use these as needed through treatment. There's also some orthodontic wax in your bag. The wax is used to place over any bracket that may be rubbing or any wire. You're going to take the wax and roll it in a ball and place over the bracket, and this alleviates it from rubbing against your gum tissue or your cheek. You also may notice as treatment continues, the extra wire will come out the back. We actually recommend clipping the wire with a pair of little fingernail clippers, or you may place the wax over the wire until we can get in and get that scheduled to get that cut for you. You also may notice on the model that there's a loose bracket. Throughout treatment, it can be common to have a bracket come off now and then. If a bracket does come loose, it's going to slide back and forth on the wire. This is not considered an orthodontic emergency. However, you may give our office a call to give us a heads up that you do have a loose bracket so we can get you scheduled to get it put back on. Until that time, you can go ahead again and use the wax to place over the bracket to help hold the bracket from sliding back and forth on the wire. Also in your bag, there's going to be some brochures that you want to take the time and read over. Again, this brochure may go over some things that may happen at home as far as a loose bracket or a poking wire. Again, you can use the wax or a pair of fingernail clippers, and again, this goes over that. This is going to go over what type of foods that you should try to avoid away from throughout treatment, or avoid. Anything sticky, gooey, or chewy, gum, taffy, Tootsie Rolls, biting on ice cubes, pens, pencils, and eliminating sugary soft drinks. On the back of this brochure, before we go over the brushing, you may hear us use the term throughout treatment white spots or decalcification. This is what forms on your teeth from not having good hygiene throughout treatment or good brushing. This is what we want to try to avoid. When you have your braces removed, we do not want to have white spots on your teeth. Again, I'm going to go over the brushing with you so we can avoid the white spots, but please take the time to review these pamphlets. In your bag, you're going to be receiving a toothbrush, a travel size toothbrush. This is called a proxy brush. You're going to be receiving a travel size proxy brush, and these are called plackers or floss threaders. This is going to be helping you floss. As far as brushing, we recommend that you brush at least 3 to 4 times a day or after every time you eat. Every time you eat, the food is going to collect around the brackets and eventually can turn to what we call plaque. And that plaque is what eventually turns to and causes the white spots on your teeth. This brochure also will go over the brushing techniques that we recommend that you use during treatment. We actually recommend that you stay away from the back and forth motion and use a more circular motion in going around the brackets. This helps to get the bristles down in between the brackets and the teeth. You want to take your toothbrush and at an angle and make sure you're getting above the brackets and around your gum tissue. It also helps sometimes to turn the toothbrush like this and go around each individual bracket. Again, making sure that you're getting above and below the brackets, and again on the inside of your teeth. Above and underneath. On the lowers, again, you want to make sure you're getting that area underneath your brackets. I actually recommend getting a handheld mirror or staying close to the mirror in the bathroom so you can kind of see what you're doing and what you're missing, what areas you're missing. It also is recommended that you take your time and brush at least 2 to 3 minutes while you're brushing. So we're going to brush a couple times throughout the day. Before you go to bed every night, we do recommend that you do take a couple extra minutes and take some time and do these extra little steps. So you're going to go ahead and brush. This is a good time after you're done brushing before you go to bed to use the proxy brush. You want to take the proxy brush and go away from the gum tissue, in between the brackets underneath the wire, and this helps get where the toothbrush can't reach. Again, on the lower, you're going to go up underneath the wire, in between the brackets where the toothbrush can't reach. After you brush, do the proxy brush, you're again going to floss. You're going to take the flat side of the floss underneath the wire in between the teeth. As I explained previously, oral hygiene is very, very important during braces, keeping your teeth nice and clean. So after you do all those procedures before you go to bed, we do recommend that you use a type of fluoride rinse. This bottle will be for you to try and take home today. Each additional bottles you may purchase here at the office or over the counter. There are other brands that you may use over the counter, but a fluoride rinse is very important to use to help protect against those white spots and also from cavities. So we do recommend that you use this daily. Again, a great time to use it is at night before you go to bed after your teeth are nice and clean. The last thing that we're going to go over is an orthodontic mouth guard for sports. If you do play sports, we do recommend that you use a mouth guard. We do have these here free for you at no charge. If you have not received one and you need one, please ask for one. You do not want to boil them, but you may trim them to fit as needed. This concludes the instructions for your oral hygiene care. We look forward to treating you here at Pine Orthodontics.